Good afternoon, everybody. Welcome to CV Live. My name is Dr. Randall Wolf, and it's my pleasure to spend the next several minutes with you talking about one of the topics that's near and dear to a lot of people, and that's atrial fibrillation. Most people in the United States either have AFib or know someone that has AFib or has a family member that has atrial fibrillation. And I wanted to focus during this talk on a few aspects of atrial fibrillation that you may not be aware of. I'm coming to you from DeBakey Heart and Vascular Center. Our fearless leader, Dr. Alan Lumsden, is putting on this series and was kind enough to ask me to present on the topic of atrial fibrillation. During this presentation, this is live. If you have a question, you may query me and we will answer your question. There are a couple ways to do this. One is with a text DeBakey, that's D-E-B-A-K-E-Y, to 37607. Text is DeBakey to 37607. A second way is online, and the online way is pollev.com/DeBakey. That's P-O-L-L, like a poll, P-O-L-L-E-V, period, C-O-M/DeBakey, D-E-B-A-K-E-Y. And that'll come up on your screen from time to time, so you can text or you can go online, send in a question. Be happy to address your question during this talk on atrial fibrillation. You will also see from time to time on the screen a number to call for a complimentary second opinion on atrial fibrillation. In other words, if you or one of your loved ones is suffering from atrial fibrillation, you'd like to get a second opinion, we offer a complimentary second opinion. All second opinions will be answered personally by myself. And for that, the number that will flash on the screen from time to time is 877-900-AFib. That's a toll-free number, 877-900-AFib. AFib is 2342. So 877-900-2342. But if you have a question just during this hour, I suggest you use the text DeBakey to 37607 or online pollev.com/DeBakey, because I'd like to make it as interactive as possible. There are no stupid questions. Atrial fibrillation is poorly understood, even by clinicians. I see some patients that have really done their homework. They know a lot more about AFib than a lot of physicians do. Feel free to contact me during this program and we'll answer your question live. If it's after the program, you can call that toll-free number and we'll give you a complimentary second opinion. And this is something we've initiated here at DeBakey. We also, if you're in the Midwest and you'd like to have a live teleconference, I do have a place in Cincinnati where we can have a live teleconference with you. I see many patients from the Midwest there. It allows you to see me and I can see you without you flying to Houston, Texas, although we welcome you in Houston, especially this time of year because it's rodeo, so it's a lot of fun right now. Back to the topic. I do all my work seeing patients and procedures at the Houston Methodist Hospital here in Houston. And if you're looking at the slide, you can see Dr. DeBakey in the background. And also at the bottom right-hand side, the new tower, the Walter Tower. This is a 21-story state-of-the-art tower where I perform the atrial fibrillation procedures. And then you can see on the left-hand side just a picture of me in front of the lobby next to the operating area of President Bush and his wife, Barbara. This is one of the topics that I use to talk about stopping blood thinners, how to eliminate strokes. We'll talk a little bit about that, but I also want to bring up something you may know nothing about, and that is that there is evidence that a lot of the AFib comes from an imbalance of the autonomic nervous system. In other words, for some of you that suffer from AFib, you might like to hear this. There may be nothing wrong with your heart. I'll say that again. There might be nothing wrong with your heart when your heart's in AFib. It may be just an imbalance of the autonomic nervous system. So that's been one of my focuses for the last 16 years. I first learned about this with my association with Dr. Sonny Jackman and Ben Sherlock at University of Oklahoma, who showed in animals that you could stop AFib by changing the autonomic nervous system very slightly around the heart. And during the procedure that I do for AFib, we check the autonomic nerves and we isolate the autonomic nerves. So we'll talk a little bit about that. It's something you may never have heard about. To give you a little more background though, I do want to mention my disclosures. I'll mention some products from a company called AtriCure. I've invented some of those projects, and I continue to work on the engineering product development team from AtriCure. And this company makes some of the instruments we use during minimally invasive and open procedures. Last year here at Houston Methodist, I had the privilege of seeing patients from half the states in the United States, in fact 26 US states, where patients who had atrial fibrillation flew to Houston to Methodist DeBakey, and we did the mini-maze procedure, performed the mini-maze procedure, and they've all done very well. And one of the patients from California sent me this next video that I'll show you just a little bit of. He did a little bit of background. He is a pilot. We take care of a lot of pilots because when pilots get atrial fibrillation, they're grounded. That's their whole livelihood down the drain. We get those pilots back up in the air. In fact, I met with the FAA last year for a couple of days because they found that if a patient had AFib and was a pilot and had the mini-maze, they could get them back up in the air, AFib free and without medications. So this is a pilot from California. He heard about the AFib procedure, the mini-maze, at a talk I gave in Dallas about 3 years ago. 2 years ago, he flew to Houston. We did the mini-maze procedure. He went back, he got his pilot's license back, and by the way, he's also a skydiver. And he got that back, and he sent this video. And here he is jumping out of a plane, and he joins his friends who are also skydiving. And I'll tell you what, after the mini-maze, if you can do this and not get AFib, I think your AFib's cured, because that's a pretty good stress test for AFib. So they're free falling there, and on his arm, this is what he sent to me, he had this: AFib grounded me, wolfminimaze.com got me back in the air. So he filmed this. One of his friends had a little camera on his helmet, and he filmed this while they were skydiving, and this is after his mini-maze, and he no longer has atrial fibrillation. And they do this for longer than I thought you could do this. Remember, they're free falling back towards Earth, which is pretty scary. It's amazing testimonial to show that for those of you who have AFib, there is hope, there is help. You can get rid of your AFib, and there he goes. See ya. So that's quite a testimonial to show that it's not always true if you suffer from AFib and you're told there's nothing you can do about it, you just have to take blood thinners the rest of your life and live with it. No, there are solutions. So people want to feel better, you can feel better, and you can also beat AFib. The way we started with a new procedure is with a new instrument, and this cartoon shows the basic procedure using a new instrument. It's a modified clamp that fits around the back of the heart. And if there's a focus of AFib, as you can see here represented by the yellow dot, then this clamp can encircle the pulmonary veins up on the left atrium where most of the AFib starts. But most likely that yellow dot is an imbalance of the autonomic nervous system. Make a line through the heart, almost like drawing a pencil, and then that renders that area with no water, and that creates a block, and that can stop the atrial fibrillation. So this is what the cartoon looks like, and this is what we do every week here for the mini-maze procedure for patients who have atrial fibrillation. Now that little dot, that little focus, can no longer stimulate the rest of the heart into atrial fibrillation. We started this in the animal lab 20 years ago. That was the first clamp in an animal lab to show that we could surround the pulmonary veins. After that, I started doing open cases. These were patients who were undergoing heart surgery anyway for a valve or bypass surgery, and we used this clamp to stop the atrial fibrillation. After that, the company AtriCure started as a spin-off of another country. So that's a little bit of the history. And those initial cases were open heart cases. But while I was doing these open heart cases, as depicted here in this video from 2002, I was thinking, what about the millions of patients who have AFib that aren't undergoing open heart surgery? They have what's called lone AFib. Lone meaning there's no other heart disease, there's no valve disease, there's no coronary blockages, just AFib. Can we do something for these sufferers of AFib using this new technology, which is very effective? And over the next several years, I worked on devices and a procedure that could be used to treat atrial fibrillation in patients who don't need open heart surgery. They just need to be cured of their atrial fibrillation. And back in 2002, we did some studies to show it was feasible. And the following year in 2003, the first mini maze was performed. Now, it wasn't called the mini maze then. It was just called bilateral pulmonary vein isolation and closure of the left atrial appendage. About a year after doing one of these procedures on a gentleman in Cincinnati, where we started, who was a VA patient, the patient came back to me and said, "Doc, you cured my AFib." He also was a pilot. He said, "I'm back flying again. I'm back jumping out of airplanes again, but nobody knows about this bilateral pulmonary vein isolation and closure of the left atrial appendage. You need to get the word out." And I said, "George, let's talk about it." He said, "No, Doc, you don't understand. I already started a website and it's out there, and I named it Wolf Mini Maze." So I personally did not name it that, but a patient who was a pilot from the VA who had the mini maze named it the mini maze procedure. And it's a good thing he did, because that's how the word started to get out there that there was another option for sufferers of AFib. People who have been taking medications, don't like medications. People who have been taking blood thinner, don't want to take the blood thinner anymore, can't take the blood thinner anymore. This is an option. Patients who cannot have a catheter ablation or who have failed several catheter ablations, this is an option. And what it consists of, and this is a picture of a patient during the procedure, through a scope going between the ribs, we can see these pulmonary veins, we can isolate the pulmonary veins, and by the way, at the same time, we isolate these little nerves on the outside of the heart. Now, one of the beauties of approaching AFib this way is that the nerves are on the outside of the heart. Well, we can see this area, we can treat this area. With an endovascular procedure, a catheter ablation, it's not possible to visualize or treat these little nerves. And remember what I said from the beginning. It may be that when you have AFib, there's nothing wrong with your heart. You have an imbalance of the autonomic nerves. So it makes sense that you want to address these autonomic nerves on the outside of the heart. And you can see here from this picture, that can be done very clearly with a mini maze type of technique. We had proved in many heart specimens that applying this clamp made beautiful lines on the heart, and this is achieved in about 12 to 15 seconds. So it's very quick compared to a catheter ablation as far as achieving a line of block to treat the atrial fibrillation. The cartoon here on the left side of the screen shows the approach. You've heard of people having their knees scoped. You've heard of people having a laparoscopic approach. Those are the same instruments that I use. Some of them are modified to work around the heart, but the scope is the same one that's used for a laparoscopic cholecystectomy or a laparoscopic appendectomy to remove the appendix. The difference is we're using the scope between the ribs a little bit higher than the abdomen. We're using it in the chest on the side. It's under general anesthetic. We don't have to stop the heart. We don't have to use the heart-lung machine, and we don't have to give blood thinners. But we have very good visualization of the pulmonary veins and these little nerves on the outside of the veins, which again is part of the topic of my talk, we can get to these little nerves that probably start the AFib. There is a term for this. It's called vagal AFib. Some of you may have heard of this. Vagal AFib means the autonomic nerves are the stimulus that puts the heart out of rhythm. So maybe there's nothing wrong with the heart. So it would make sense then, logically, not to burn the heart so much, but to attack these nerves. As I mentioned, I did develop some other instruments that facilitate this through these little incisions, because during the mini-maze procedure, no hands are put inside the body. It's all done with extended instruments through small incisions. The other part of the mini-maze that's important as a background is, for the first 1,000 cases, I removed the left atrial appendage. The left atrial appendage is on the back of the heart, and it's where blood clots form. So for those of you that are concerned about strokes and AFib, almost all the strokes come from that little appendage, that little ear on the heart. And with the mini-maze procedure, that ear is completely closed. You can see here on the screen our first publication on this back in 2005. I see a question here, and I'd like to address these questions. Again, if you have questions, text to DeBakey to 37607. That's DeBakey to 37607, or online poll, pollev.com/DeBakey. So let's take a question right now. First question is, how many surgeons can offer this being the mini-maze procedure? One of the reasons that I relocated to Houston, which is a much larger geographical area or much larger population than Cincinnati, is that no surgeons were doing the mini-maze procedure here in Houston, and that's still true today, 5 years after I came here. Many hospitals will say they offer the mini-maze procedure. It's important for you as a sufferer of AFib to ask them, how many mini-mazes do you do a year? And you may find that, in fact, they do 0 to 1 a year or not at all. So they may have it on their website, but it's important to ask them. There aren't many surgeons that do the mini-maze procedure in the United States, and the biggest experience and the most number of cases per month is done right here at Houston Methodist DeBakey, and they're done by me. Here's a question. What if you've had prior ablations? You've had 2 catheter ablations, and actually that's quite common, because ablations are not easy to do, and it's difficult to get a good result. So it's very common that the AFib recurs, even though there's been 1, 2. Here at Houston Methodist and DeBakey, I've operated on a patient here who's had 5 ablations. 5 ablations. So the answer to the question, can you have a mini-maze after ablations? Yes, and truly, in a retrospective review, over half the patients that I take care of have had at least 1 catheter ablation, and as many as 5. So half the patients have had catheter ablation. Some of the patients have had a stroke. What if you've had a stroke from AFib? Can you still have the mini-maze? Absolutely, and after the mini-maze procedure, you do not have to take blood thinners anymore. So one of the big advantages of a mini-maze procedure is you don't have to take blood thinners anymore. If you look at taking a blood thinner such as Coumadin or Xarelto or whatever you might be on Eliquis or Pradaxa, which is pretty expensive, by the way, those blood thinners decrease the risk of stroke by 60%. They decrease the risk of stroke by 60%. The mini-maze and removing or closing the left atrial appendage decreases the risk of stroke by 97%, almost 100%, and no more blood thinners. You're done with them. Let's take another question. How can I get in touch with you for a second opinion? Good question. The easiest, there are a couple of different ways. One is to go to wolfminimaze.com. That's my last name, no E, W-O-L-F, and then mini, like little, M-I-N-I, mini, and then maze, M-A-Z-E, like a mouse maze. So it's Wolf, W-O-L-F, mini, little, M-I-N-I, maze, M-A-Z-E.com. wolfminimaze.com is the website, or there's a toll-free number, 877 877-900-AFib. 877-900-AFib, and AFib is 2342, so it's 877-900-2342. So please continue with the questions. These are excellent questions. Text them to DeBakey to 37607 or pollev.com/DeBakey. One of the things I wanted to talk with you a little bit about is this idea that the autonomic nerves have a big part in the initiation of atrial fibrillation. This has been proven in the animal model for years, and I started testing this in the human, first time ever in the world, 16 years ago, with the help of Dr. Sonny Jackman and Dr. Ben Sherlog from Oklahoma, and it's amazing. If one takes a tiny probe with a little bit of electricity, not even enough that you can feel it on your finger, and touch the heart over these autonomic nerves, and they're active around the heart will just stop. And when you stop stimulating, the heart starts beating again. This response can be stopped by simply using the probe on the heart and sort of burning this little area of the nerve. After that's performed, then we touch down on the heart, we stimulate the nerve, nothing happens. And one of the reasons that we believe the mini-maze is very successful in a randomized trial, heads up with catheter ablation, mini-maze wasn't 5% or 10% better, it was 100% better. One of the reasons we probably get such good results is because we're isolating these autonomic nerves. These are the nerves that make your hands sweat when you look over the edge of a tall building. If you've ever gotten that, you know what I mean. You look over the edge of a tall building and you feel your hands getting a little moist. These same nerves are around the heart. These are the same nerves that make your heart beat, make your heart race when you're watching a scary movie. Why should your heart be racing? You're not running, you're just sitting there. These are the autonomic nerves. These are the nerves that are activated during stress, and as you know, a lot of times stress can bring on atrial fibrillation. If these nerves are interrupted, that stress response does not initiate the atrial fibrillation. So that's a key point. You won't hear about this from anybody else. These nerves cannot be reached with a catheter ablation. They cannot be reached with medication. But every day in the operating room here in Houston, Texas, at the DeBakey Center at Houston Methodist, that's what I do. I test these nerves and isolate these nerves that are probably initiating lone AFib. This was an article that's on the screen here that addressed this. This was back in 2007, and we showed that in a small cohort of patients where we definitely looked at the ganglionic plexi, these little nerves on the outside of the heart, and treated them, and then followed up 6 months later, 13 out of the 14 patients were in rhythm. So it makes a difference. I'm convinced, and we continue to do it today. Just to give you a glimpse of what it looks like with the mini-maze procedure, this is a heart. This is through the scope. We've opened the heart sac. All animals, whether you're a squirrel or a raccoon or a human, have a sac around your heart. This is the device around the pulmonary veins. It only takes about 12 seconds to make that line. We can see everything. We can do everything. We can get the heart back in rhythm. We can test the ganglionic plexi. We can test the validity of the line we make, and we can get the heart back in rhythm. This is direct vision. Now, the hands are not inside the body. This is a scope, as I mentioned, looking inside the chest, and we can see the heart. And there you can very clearly see the lines being made by closing the clamp. And then the clamp is removed. This clamp doesn't stay in the body. Sometimes people ask me, does the clamp stay in the body? No. We just use it to make these lines, and we remove it. And this clamp also interrupts these ganglionic plexi, these little autonomic nerves that are right underneath where you see the clamp right there. And there you can see the heart beating. We don't stop the heart. We don't interrupt the heart motion. We don't use any blood thinner, and patients are awake at the end of the procedure. Why this is playing, I see a very good question. I've had open heart surgery. Is it still possible to do the mini-maze? The short answer is yes, and I've done about 30 patients where they've had open heart surgery and now they're in rhythm after the mini maze. It depends on which surgery you've had. The most common is bypass surgery or aortic valve replacement. And in fact, one of, I guess you could say one of my more famous patients is a retired colonel in the Air Force named Chuck Miller, who's given me permission to use his name. And he recently published a book about his experience in the Air Force. And he also talked about his mini maze procedure. But before his mini maze procedure, he did have open heart surgery and had bypass surgery. He said he went in with AFib, they did bypass surgery, he went out with AFib. And a couple years after his bypass surgery, we did the mini maze procedure. Ladies and gentlemen, that was over 12 years ago. He's still in rhythm. And he had a low cardiac output. His ejection fraction was 15%. They were thinking about him having a heart transplant. Instead, we did the mini maze, and now his ejection fraction is 57%. And he doesn't take any medicines for AFib, and he's in rhythm. There you can see we're testing those nerves. You can see the heart slow down dramatically. That's the little device I use to stimulate the nerves and test the nerves. There it is. There's the heart stopping. The top two chambers will still quiver in AFib, but when we check one of these spots, there, check the spot, the bottom chamber just stops. And then we burn those little nerves, try it again, no response. So we've obliterated that nerve response, not burning up the heart, but eliminating that nerve response. And that's what's different, one of the differences of the mini maze procedure. So if you believe maybe your heart isn't the problem and it's stress and it's a nerve problem, there's a good chance that this could help you become AFib free. Now at the top of this you see, now we're putting the clamp on again. Now since we put the clamp on, the patient's back in rhythm already. A lot of times that happens. We've done the right side, now we do the left side, boom, the heart's in rhythm. And look how much happier that heart is in rhythm. A nice slow beat, not that erratic, chaotic beat that you saw before we applied the clamp. And this is without cardioverting the heart, this is without shocking the heart. The heart does it on its own once these veins have been isolated and these little nerves have been isolated. And there you can see the heart in rhythm. Now at the top of the screen is that little area, that's the left atrial appendage, that little appendix. How do we reach that? Well, I'll show you how we do that. This is a patient. This is on the left side. That's the left atrial appendage. And now instead of removing the appendage, most commonly I close the appendage with this clip. This is called an AtriClip. I was the first one to use this in a patient after these were available. I've probably used more of these than anybody else in the world. And there you can see the clip is around the appendage. We simply release the clip and the appendage is then closed off. No more blood gets into the appendage and you don't have to use blood thinners anymore, because the reason you're taking a blood thinner almost always is to prevent a blood clot in one spot. It's that appendage. You're trying to prevent a blood clot in that appendage. So if that appendage has been closed, then you no longer need to take the blood thinner. So after the mini maze, patients do not take blood thinners. There's no need to. And the AFib stroke rate goes down from 60% protection with a blood thinner to 97% protection with this little clip on the atrium. That's on the appendage. Just as a historic note, I put this slide in here. I wanted to mention to you, I certainly wasn't the first one to do this. I stand on the shoulders of many giants. The appendage was first closed using a surgical technique in 1960 by Dr. Madden in New York. And he did publish this. Resection of, at that time it was called the left auricular appendix. Now we call it the left atrial appendage. But initially it was called the left auricular appendix because it looks like an appendix. And this was a patient who had AFib and blood clots were forming in the appendage and then going out to the patient's arm and causing a blockage of the artery. And he closed the appendage in this patient. Dr. Johnson in 2000 also said maybe we should be closing this appendage every time we do heart surgery, and I think we should. It's simple to close it and can dramatically decrease the risk of a blood clot from the heart. I'm going to take a quick drink here. Again, if you have a question, I'm happy to answer it. Text DeBakey to 37607 or online pollev.com/DeBakey. If you'd like a complimentary second opinion for you or one of your loved ones for AFib, 877-900-2342, 877-900-2342, which is 877-900-AFIB, 877-900-AFib. Here's a question. I had part of my lung removed. Can I have this operation? Well, it depends. We should do a free complimentary second opinion at 877-900-2342, because I have been able to do this, but it depends on what part of the lung and what type of procedure that you've had. But the short answer is yes, not in everybody, but I have been able to do that. So we take this on a case-by-case basis. I'd love to talk to you about your situation. Perhaps we can help you. Getting back to the presentation, we've talked about a very elegant way of isolating the pulmonary veins, of closing the appendage, and very importantly, isolating the nerves around the heart that may be the stimulus that kicks the heart out of rhythm, these ganglionic plexi. What happens if you have AFib? Many of you have probably been told, you have AFib, you just have to live with it. You'll be all right. Well, that may not be true. And the article shown on the slides here was one about asymptomatic AFib. That means you don't feel the palpitations. Should you be concerned? And the answer is yes. It's associated with the increased risk of stroke, and it's also increased with increased risk of having a shorter lifespan. And also there's an increased risk of dementia. Now this is a broad category and it's hard to prove, but there's been some large studies that suggest if your heart stays out of rhythm for a long time, you do throw some little clots to the brain, maybe not a full-fledged stroke, but this could lead to an increased risk of senile type dementia. So we talked about the left atrial appendage. Not only closing it decreases your chance of stroke, but it also allows you to stop blood thinners. And what I didn't mention before, it can decrease your chances of having AFib, because sometimes this abnormal electrical signal on your heart goes through that ear on the heart, that appendage. And if we close the ear, then that stops that flow of that electrical current and can help you go back into rhythm. I'm going to take a short 2-minute break, take a drink of water. I'll be right back. I'll take more of your questions.
Re-Evolution is a meeting that started 10 years ago. The goal over here was to teach people new techniques that they could use in cardiac surgery, specifically minimally invasive techniques. The meeting is geared towards physicians in practice, but also trainees that are doing their training in cardiothoracic surgery, where they don't necessarily get exposed to minimally invasive techniques such as the kind that they need to use in practice.
As an early career trainee in cardiac surgery, going to this conference means a lot to me, to be able to be exposed to the entire realm of minimally invasive cardiac surgery, to be inspired by world-leading experts and all the new and upcoming technologies that are coming forth for our field, and to be able to be inspired to innovate and to learn these technologies so that I can one day apply these in my practice and to be able to keep our specialty surviving and thriving.
There is a significant increase in awareness that these are less invasive procedures that do have a significant benefit. And to be able to come and train in these if they don't already know how to do these or are not familiar with them is something that will certainly benefit their own practice in their local environments, but more importantly, it'll benefit their patients and allows them to be on the cutting edge of cardiac care. To be able to do these and get the hands-on experience at Re-Evolution Conference is an excellent opportunity.
Welcome back, everybody. Dr. Randall Wolf here, DeBakey Heart and Vascular Center. As I mentioned at the beginning, I was kindly asked by Dr. Lumsden, our fearless leader, to discuss with you atrial fibrillation and some different things about atrial fibrillation. So we've talked about a different procedure, and we've focused on the fact that it may not be anything wrong with your heart when you're in AFib. It may be an imbalance of the autonomic nerves around the outside of the heart, and these are around the pulmonary veins. So we talked about how those can be addressed with the mini maze. The question often comes up, how can I get more information about this procedure and what you do online? So we put up here on the screen thewolfminimaze.com. We get a lot of traffic through there, and there's also a mechanism there, a number that you can call, or you can give us your information, and we provide you here at DeBakey Heart and Vascular Center a complimentary second opinion, no matter where you are in the United States or wherever you are in the world. Complimentary second opinion. I talked to a gentleman this morning who's a veterinarian in Oregon, and he'd like to come down for the mini maze procedure. I talked to a gentleman also this morning who is a, I'm sorry, I might get mixed up here. I talked to another gentleman from Virginia who's also a physician who wants to come here for the mini maze. The person from Oregon is, in fact, I'm getting mixed up, is a neurosurgeon. So a retired neurosurgeon who wants to come down. So we get a lot of inquiries from professional folks. We take care of a lot of attorneys from around the country. If you go to wolfminimaze.com website, you'll see some interesting testimonials, including an attorney from Chicago whose her dad had AFib. He was told there was nothing else can be done. He had 3 catheter ablations. He was despondent, suicidal. As a last ditch, they found us through the internet. He had the mini maze procedure, gosh, it's been about 5 years ago. And since then, he's had no AFib. He moved to Florida from the Chicago area, bought a condo, and plays golf every day, and doesn't have AFib anymore. When his daughter, the attorney, had AFib, and this does run in families, a couple years ago, she just flew to Houston. We performed the mini maze procedure on her, and 3 days later she was back in Chicago, and she's been AFib free ever since. So if you'd like a complimentary second opinion from DeBakey Heart and Vascular Center, 877-900-AFib, and I will answer all these personally, and I will call you back and discuss your situation with you. Been doing the mini maze for 16 years, but talked to a patient 12 years after his mini maze. It was the first patient we had done in 2003, and he was still in sinus rhythm. There have been lots of other ways to try to address AFib, microwave, high intensity focus ultrasound, and the reason these are dropping from the slide is because they've come and gone. It was supposed to be the latest, greatest, but it didn't work. But what I showed you, that clamp, still works, and it works very well. Here's a patient, just for an example. Someone asked, what if you've had previous ablations? This is a patient who's had 3 previous ablations, and we can see these little white spots on the outside of the heart where they had the ablations, but their pulmonary veins weren't isolated, and this is technical, but that second line is seeing the electrical signal on the patient's heart. After a catheter ablation, that second line should be flat, but it's not, so they're still getting signals after 3 ablations. We use that clamp that I showed you, and then we check again on the heart, and those signals are gone. So finally now, the signals are gone, and they're AFib free. This was a trial I mentioned, 55 patients in catheter ablation, 55 patients having mini-maze, and at 1 year later, the mini-maze was twice as effective as getting the patient in sinus rhythm. So it wasn't 5 or 10% better, it was 100% better. Adding a lot more lines, by the way, some people will say, well, what if I have a lot more lines? Will that make it better? Not really, it doesn't add a lot. I wanted to mention to you that we're very objective here at DeBakey Heart and Vascular Center, and 90% of the patients that we perform a mini-maze procedure on, we follow up with an implantable monitor. This is a monitor that's about the size of half around in my ink pen and about that long, that we can put in under the skin, under local anesthetic in the office, and it allows us to follow your heartbeat for 3 years. So if you think you're having another episode, you can call me. I can tell you by looking at the implanted monitor whether there's any AFib or not. So this is called the Link device. It's an implantable monitor. I use it post-operatively. You don't have to go to the doctor's office then. You don't have to go to the ER. We know if you're in rhythm, and we get the report every day. Let me take a question here. Will caffeine have a negative effect on me post your mini-maze surgery? So there are lots of triggers for AFib. It's a good question. It brings up that whole area of what triggers my AFib. Is it stress? Is it caffeine? Is it chocolate? Is it Coca-Cola with caffeine in it? Is it a cold drink? Is it a hot drink? Is it too much exercise? Is it too little exercise? Everybody has their trigger for AFib, but our goal is to make it so after the mini-maze procedure, you can live your life. So what I tell patients after the mini-maze, you want to have a cup of coffee, go ahead. Probably don't drink 6 cups a day, but if you want to have 1 or 2 cups of coffee, that's fine. So we want to get you back to what you normally do. Our goal is to get you back to your regular lifestyle. Here's a new thing that we're finding. We've found over years that patients after the mini-maze have a lower blood pressure. So we're finding now that most of the patients that are on blood thinners after a mini-maze don't need their, that are on blood pressure medicines after their mini-maze don't need their blood pressure medicines anymore. They don't need their blood thinners either. But now, many patients that are on 3 blood thinners before the mini-maze, afterwards, they're on 0 to 1 blood thinner after the mini-maze. And this is also being found in other studies. So not only does the mini-maze help your AFib, it dramatically decreases your need for blood pressure medications that you may have been on before the mini-maze procedure. We've also found that the mini-maze is very safe. There was a study done back in '09 that showed with catheter ablation, there are lots of little pieces of stuff that go to the brain. It may not be a stroke, but they're little pieces of things that break off that go to the brain. With the mini-maze, that doesn't happen. So that's an exciting development that we're still working on. Now here's an interesting question, and a question I've never gotten before, but it makes sense because this is new. Does AFib make me more susceptible to the coronavirus? Wow. Interesting question, and I'm glad you brought that up. I had not thought about that, so this is on the fly. I suspect the answer is no. I suspect the answer is no. It is true that your heart works harder when you're in AFib, you're more tired, you have fatigue, you have shortness of breath, but I doubt that it makes you more susceptible to the coronavirus. Probably more importantly is what the government's been telling us. Wash your hands, maybe not shake hands with strangers. It was interesting, I went to vote today today's voting day here in Houston. I was walking up to get in line, and one of the people running for office went out to shake my hand, and I declined, not because I had anything against that particular person running for office, but I thought this person has probably shook hands with 2,000 or 3,000 people already today. Maybe it's not a good idea to shake hands with her. I hope she didn't take it the wrong way. But I think the answer is probably no on the coronavirus. I don't think it makes you more susceptible. How to get a second opinion. As I mentioned, here at DeBakey Heart and Vascular Center in Houston, along with Dr. Lumsden, who's approved this, we're offering complimentary second opinions for AFib. It's simply go to wolfminimaze.com or call 877-900-2342. That's a toll-free number, 877-900-2342, 877-900-AFib. Or you can go to Wolf Mini Maze, my name without the E, W-O-L-F, no E, mini, little, mini, and maze, M-A-Z-E.com, wolfminimaze.com. It's a website. You can inquire for a complimentary second opinion through the website or through calling that number. I even take the calls on my cell phone. These will come through and I can answer your questions by calling you back. Happy to do so. So we monitor our patients. We know what our incidence of AFib free rate is. And this was, oh gosh, this was back several years ago when this was 2014. So now this is 6 years old. Looking back on patients 1 to 6 years out, and AFib free rate, depending on the type of AFib, is still very good. If you have AFib that comes and goes, we're running over 92% AFib free rate. And patients that have had previous catheter ablation do very well after the mini maze procedure. They're up in the 92% range as well. My personal experience now is over 2,000 patients performing the mini maze. I've also done it in 20 other countries. And here's a little tidbit for you. Yes, I have done the mini maze procedure in Wuhan. Fortunately, not this past year, but I've been to Wuhan several times in China and performed the mini maze procedure. If you've ever been to Wuhan, you understand what they're going through. It's a very crowded city. It's bigger than New York City. It's hot, it's humid, hot and humid, not human, hot and humid, and there's no personal space. When you get in line, people are always pushing you from behind, so you can see where spread of a virus could happen pretty easily. So yes, I have performed a mini maze in Wuhan. Some of the questions that came up are also addressed on this slide. It doesn't matter what type of AFib you have. It doesn't matter if you've had a previous ablation. It doesn't matter if you've had a previous stroke. It doesn't matter if you can't take blood thinners. And it doesn't matter if you've failed all medications. In fact, those are candidates for the mini maze procedure. I put up a quick testimonial. This is from a nurse. And this is on the website. She had 3 failed ablations. She told her only option was to have a pacemaker placed and ablate her own pacemaker. And I don't think that's a very good option, but you may hear that. I don't recommend that. And she said, I thought there must be a better way. She did her research online. She went to wolfminimaze.com. She ended up having the mini maze, and now she has no more AFib. She's off all her blood pressure and blood thinner medications, and she's a very happy patient. As I mentioned, she's a registered nurse and she's from Wisconsin. We see patients from all over the country. There are published articles on the mini maze, but they're mainly in the surgical literature because that's where I've mainly published. We also did at one time a retrospective review with patients and said, overall, are you getting off your medications after the mini maze procedure? And 3/4 of the patients had gotten off all their rhythm control medications. There were no post-op strokes. And if you look at quality of life, which is really at the bottom line what's important to you, not only do you get rid of your AFib, but do you feel better? I mean, that's what people want. They want to feel better, and they want to have some hope. And they don't want to fear the next time they're going to have an AFib attack. With respect to that, I saw a patient in the office yesterday. He lives in Panama, but he's an American citizen. And he came to me several years ago, and he said, look, Doc, I'm going to be moving to Panama. I have AFib. I'm really scared about taking these medicines and having attacks, trying to go to an ER in Panama. He had the mini-maze procedure. It's been 3 years ago. He's had no further AFib. He came back to the office just to say, Doc, thanks a lot. You got me off my medications. I have this monitor implanted. You know I'm not having any AFib. And I'm a happy man. I'm not worried about sitting on a time bomb waiting for that next episode of AFib. I'm not fatigued. I'm not tired. I'm not short of breath. If you look at quality of life before the mini-maze, these are patients that are in AFib. Quality of life's not very good. That's what you'd expect. After the mini-maze, almost everybody's in category 8, 9, or 10, which means they're really happy. Their quality of life is much, much improved. So I hope I got some more testimonials. This was a patient 9 years out now. She came to me in AFib. She was on a blood thinner, and she said, Doc, my husband rides motorcycles. I can't ride with him anymore because I'm taking a blood thinner. I'm afraid if we're in an accident, I'm going to bleed to death. Can you please help me out? 9 years ago, I did the mini-maze on her. She's off all medications. For 9 years, she's been AFib free, and she rides on the weekends with her husband. Now, I told her it's possible riding motorcycles with your husband is more dangerous than having AFib. But, you know, it's quality of life. She can ride with her husband, and she's a very happy patient. One of our patients, the one who did that skydive, Ross, made out a matrix, and I think this matrix is coming up on the website. And he sat down. He's a very thoughtful guy. This is the pilot before he came to see me, and he said, I put down everything you can do for AFib. Do nothing, take medications, have a catheter ablation, have the mini-maze, and I put the pros and the cons on this decision tree, and this is available for you if you'd like to see it. Well, here's another interesting question. Dr. Wolf, is it true you are a performing magician? That is true. And from time to time, I do a show. The last show I did was 2 weekends ago in Key West. It was, interestingly, a patient who has a home on Key West, or really he lives in Marathon Key, and he was having a birthday party. He flew to Houston about a year ago, had the mini-maze procedure. He's now off all blood pressure medications. He's AFib free, and he said, Doc, I'm going to pay you to come down and do a magic show at this birthday party. So flew down to to Miami, drove to Marathon Key, and did a great, had a great birthday party, and did a magic show there. So yes, that is true. And if you come to Houston Methodist and have a mini-maze, I promise you, I will do a magic trick for you in your hospital room. So I think that's most of the stuff that I wanted to cover about the mini-maze. Again, if you have further questions, I'm going to go to this, skip over to this slide that shows the website again. And that is right here. wolfminimaze.com, and it also has the number 877-900-AFib. If you have ideas for a CV live discussion, please send those to us. Text DeBakey to 37607, or the online pollev.com/DeBakey. If you'd like a complimentary second opinion, I've been authorized by Dr. Lumsden, our fearless leader, to give you a complimentary second opinion at 877-2342, 877-900-2342, or you can go to wolfminimaze.com. It's been a pleasure talking with you. I hope I've educated you a little bit on atrial fibrillation. Atrial fibrillation is one of those diseases where you have time to do your research. So this is how you do it. If you're interested, come talk to us, come visit us. Thank you for your time, and until the next CV Live, so long from Houston, Texas.